This video is for people that have chronic pain from lumbar spinal stenosis. They may have had severe low back pain prior, but now they're moving more into their typical chronic pain from the lumbar spinal stenosis. This is the beginning stages of rehab for people with lumbar spinal stenosis. We're going to review whole body stabilization exercises along with balance training that will work into more of endurance muscular strength of all those muscles surrounding the spine. You can perform these exercises every single day, but it's very important that you get down the precise technique and form, because once the form breaks down, then it starts creating abnormal movements and imbalances and can create other types of pain patterns. So make sure you check with your healthcare provider to make sure these exercises are correct for you.
Lumbar spinal stenosis warm-up for the rehab. Very important because of lumbar spinal stenosis. You're going to have osteoarthritis, a lot of scar tissue, so we're going to get the legs warmed up first with the hips. So we're going to do a lunge, stretch, elevate. It's very easy on the body to do this. You want to lunge forward, keep the back leg straight. You want to keep the core brace upright, neutral posture, and then you want to stretch to the side so you can get the QLs, the lats, and the oblique muscles. Do this about 5-10 times each side. Then move on and do cat-cows, and you go through this motion, and nice, free, easy motion, not a power move, about 10 repetitions. Get the spine heated up. Next exercise is going to be abdominal curl-ups. You're going to take your palm of your hand, put it underneath your belly button, underneath your back, to provide a natural curve of the spine. You want to brace abdominals as if you're getting punched into the stomach, and brace it as you lift your head up off that floor. You want to hold it for a good 10 seconds. Repeat it 5 to 10 repetitions. It's important to hold for the full 10 seconds so you get maximal effects of the contraction. When you perform abdominal curl-ups, it's going to help stiffen up the lumbar spine. So as you're performing your activities of daily living, you're bending and twisting around the house, that it's going to help stabilize the spine, prevent any type of micro motions, and throw you into exacerbation of symptoms of those lumbar spinal stenosis. Now, our next exercise we're going to do, it's called bird dogs. Now, the bird dog, you're going to get on all fours, and you're going to extend out the leg, press the toe down, press the heel away from the body. Make a fist with the opposite hand. And you're going to press and stretch out from both sides as you're keeping the core stiff. You want to extend out, feel that stretch as you're tightening up the core and the glute muscles. Then you reverse it, you hold it for a good 10 seconds. Press out away, hold for 10 seconds, and then you're going to repeat this 6 times each side. Don't allow the hip to flip up like this. Keep it horizontal, keep it stiff within the core. We want to have minimal motion within the torso. Next exercise is going to be the glute bridge. Press the heels into the ground. Squeeze the glutes, press up, contract the abdominals as you're doing this so it protects you from going in too much extension. It's going to be a little bit sensitive to go into extension initially during the first part of lumbar spinal stenosis rehab. So you squeeze up into that bridge, hold for 10 seconds, and down. We want to repeat this about 10 to 20 repetitions. The abdominals and the glutes are typically going to be the weakest areas initially, and then as time goes on, it will get stronger and stronger and stiffen up the whole core. Next exercise is going to be lateral bridges for the QLs, very important for lumbar spinal stenosis rehab. So you want to start off beginning phases, bend the knees at 90 degrees, press up, make a fist, reach away from the body. Hold for a 10 count. Then you can repeat. If this is very easy and there's no pain, go to a more advanced where you straighten out the legs and reach up, keep the whole core stiff. If you feel yourself wiggling and it collapsing down, then you have to stop that exercise. Remember, we want great technique during these exercises. You want to perform this 6 repetitions each side. Next exercise is we're just going to get a band, put it at the lower part of the back. You're going to loop it around your wrists, contract the abdominal muscles, get into a cat-cow, cat-camel position, and do little cat-camels to where you're pressing up, accentuating more of the flexion. This gives kinesthetic feedback into that low back and helps stretch out as strengthening the low back muscles. You're going to do about 5 to 10 repetitions of this exercise. And once you complete this, then what you want to do is you want to work on freeing up the spine by performing about 10 cat camels with no resistance. Just get motion back in the spine so it's moving freely once again. This will get you ready for some balance training and some walking. Next thing you want to do is decompression. You want to take a wall, a fence, a chair, about 10 to 15 seconds. Can go 30 seconds. If you can go longer, great. You let the legs relax, traction out the low back. Then follow up with walking. Short periods of walk is very important during this part of rehab. As you can see, you can use a fence, allow it to decompress. 15, 30 seconds, then go for a walk again. You're going to keep repeating this so your walk gets longer and longer. Next, very important, is balance. People with lumbar spinal stenosis are typically going to have balance problems. So we want to progressively improve on returning full balance, maximize the balance. So this next video, we'll go over a progression on how to regain your balance and prevent falls and actually improve whole body stabilization with more muscular strength endurance. So check out this next video and we'll go over completely on how to balance.